When we think about something going wrong in a hospital, we usually picture one person making one big mistake, a single moment of carelessness. But what if that's not the real story? What if the very systems we build to keep us safe have these tiny, hidden flaws that can suddenly line up and cause a tragedy? Today, we're going to dig into why good, smart, caring people can still make medical errors, and it all starts with understanding the system. Let's begin with a story that shows just how easily this can happen. To really get this, we have to go beyond the numbers and hear about a real person. This is Caroline's story. She was a 37-year-old mom, and what happened to her really pulls back the curtain on the cracks in our healthcare system. So it all starts on what should have been an incredibly happy day. Caroline's having her third baby. The C-section is routine, totally uncomplicated. Everything seems to have gone perfectly. But the very next day, the first little warning sign pops up. Caroline says she has this sharp pain right at the spot where she got her epidural. The anesthetist checks it out and figures, it's probably just muscular. This one seemingly small judgment call, well, it would turn out to have absolutely devastating consequences. Okay, fast forward a week. Caroline gets discharged and sent home. But she's still in pain, and now she's even limping. This was another huge opportunity for the system to pause and ask, wait a minute, what's going on here? But it didn't happen. Once she's home, things just get worse. She sees a bunch of different doctors over the next few days. One of them later admitted he just forgot about her. Another one diagnoses her with something called sacroiliitis, which is an inflammation in the pelvis, and just sends her home with some painkillers. It's like every single person was seeing her with fresh eyes, completely missing the bigger, escalating picture. In the end, Caroline died from an epidural abscess that nobody ever diagnosed. The coroner's report on her case is, honestly, it's just chilling. It says that it wasn't one single failure. It was a chain of failures, a cascade of assumptions, where every single doctor figured someone else down the line would catch the big problem. It's a perfect, tragic example of a system breakdown. So that leaves us with this huge, haunting question, right? How could so many smart, dedicated professionals all miss the same warning signs? The answer isn't about pointing a finger at one person. It's about zooming out and looking at the system they were all working in. You know, when things go terribly wrong, our first human instinct is to find who's to blame. Who messed up? Whose fault was this? And that's a totally natural reaction. But in a complex field like healthcare, it can be a really dangerous one. So you've got two basic ways of looking at this. On one hand, there's the person approach. It's all about blame, shame, and punishment. It assumes errors happen because someone was careless or incompetent. But then there's the systems approach. This one asks a much more powerful question. Why did the error happen? It looks for the hidden causes baked into the system itself. And here's the kicker. A culture of blame actually makes healthcare less safe. I mean, think about it. If you're a nurse and you know that reporting a mistake could get you fired or shamed, are you going to speak up? Probably not. And when people don't report small errors, the system never learns. It's doomed to repeat the same mistakes over and over again. So if we're not blaming people, how do these massive system failures actually work? Well, there's this fantastic analogy that explains it perfectly. It's called the Swiss cheese model, and it's a total game changer for understanding why accidents happen. Yeah, I mean, if it's not one single person's fault, then what is it? How does a patient like Caroline just fall through all the cracks? Okay, I want you to picture a big stack of Swiss cheese slices. Each slice is a layer of defense in the hospital. One slice is a well-rested doctor. Another slice is the hospital's communication protocol. Another one is the barcode scanner they use for medication. Every slice is a barrier to harm. But, no slice is perfect. They all have little holes in them. Those are the latent weaknesses. A tired nurse, a confusing chart, a broken piece of equipment. Now, a tragedy happens when, by total chance, all the holes in all the different slices momentarily line up, creating a straight path for a hazard to get through and reach the patient. That's what happened to Caroline. Okay, so we get the problem now. It's about flawed systems, not bad people. The big question is, how do we fix it? How do we start plugging those holes in the cheese and maybe add some more slices to the stack? First off, let's be real about the scale of this. This is not a rare occurrence. Just look at this data from several different countries. The rate of what they call adverse events, basically when a patient is harmed by their medical care, is shockingly high. We're talking around 10% in a lot of developed nations. 1 in 10? Just let that number sink in for a second. That means for every 10 people who go to a hospital looking for help, one of them might actually be harmed by the care they receive. This isn't some abstract theory. For a lot of people, it's a life or death reality. So how do you find those sneaky holes in the Swiss cheese before they line up again? One of the best tools is called a root cause analysis. After something goes wrong, instead of a witch hunt, a team of people from different departments gets together. They don't ask who messed up. They ask why it happened, over and over again, digging down past the obvious answers until they find the real systemic reasons. Then they fix those systems so it can't happen again. Building a safer system also means everyone has to feel like they can speak up, right? There's a really simple but powerful tool called CUS that helps with this. It gives any member of the team, from the most junior nurse to the top surgeon, a clear way to hit the brakes. CUS stands for I am concerned, I am uncomfortable, and this is a safety issue. It's a simple script, but it can literally save a life. Now, we've talked a lot about the system and the professionals working inside it, but there is one other incredibly important person in that room who has a massive role to play in safety, and that person is you, the patient. Seriously, think about it for a second. Doctors and nurses, they change shifts. You might see different specialists on different days, but you and your family, you are the one constant throughout the entire experience. You're the expert on your own body, on how you feel. That makes you an absolutely essential part of the care team. So, what can you actually do? A lot, it turns out. Be an active participant. Tell your full story. Don't leave out little details you think are weird or unimportant. Ask questions about your treatment. If a pill you're given looks different than yesterday's, say something. If you just feel like something is wrong, speak up. You are a crucial slice of that Swiss cheese. You have the power to be a key line of defense. Look, creating safer healthcare is a team sport. It takes systems designed to learn, not to blame. And it takes every single one of us, doctors, nurses, and especially patients, paying attention and speaking up. Safety requires a voice. So the real question is, when it matters most, will you use yours?